In this video, I'm going to advocate something that members of Congress seem to be very reluctant to consider, and that is a reform of our healthcare system that would inaugurate a single-payer, nationalized healthcare system. Today we have a rather complicated medical system where we get funding from a variety of sources, mostly from private insurance companies. But where do those insurance premiums come from? Well, mostly from private companies that employ people, or private agencies that employ people. And those employers pay insurance premiums for their workers as a kind of fringe benefit. Of course, some people pay for their medical expenses out of pocket. Even some people with insurance have to pay out of pocket for co-payments and for expenses up to a certain deductible point. Then, of course, the government is paying for a great deal of health care already through veterans benefits, Medicare, children's health, and Medicaid programs. Perhaps we're spending over $1 trillion already. Now, where exactly is that money going? Well, it's going to a variety of sources. Most of these sources have a great deal to do with the quality of our health care. We've got the world's finest doctors. We pay them well, and we should continue to do so. We also have the world's most highly educated nurses giving us quality health care. Then there are other health care workers, such as those people who run the x-ray machines and respiratory therapists and physical therapists. And then what about all that medication we have to purchase? And all the other fancy equipment like the MRI machines and those wonderful, beautiful buildings that the hospitals are in. And of course we have many talented administrators running those hospitals. And of course we want to keep up the great deal of medical research so that we have great pharmaceuticals and medical equipment in the future. And of course we also have insurance companies, and those insurance companies have a lot of clerks. And the hospitals need a lot of clerks to figure out which insurance company gets which bill. And those insurance companies have executives, and those executives get million-dollar bonuses. And those insurance companies and pharmaceutical companies get billions of dollars of profits. But not everyone is treated ideally in the system, and those people go see their lawyers and file malpractice suits, and the lawyers are making quite a bit in their fees as well. What I'm proposing as an alternative is a nationalized healthcare system with the government as single payer. And I'm saying that this should be financed by a national sales tax. I think there's several advantages to doing it this way. One is that everyone will get medical care, and no one has to go bankrupt before the government kicks in and takes over a person's medical expenses. That's the way it is nowadays. Many families are only one medical disaster away from going bankrupt. So that's a decided advantage for every American. No risk of bankruptcy due to medical expenses. Another great advantage is that workers will now have a more mobile landscape in terms of fulfilling their career ambitions. They won't have to worry about making a career change that might be the best possible use of their skills just because it might create a gap in the insurance coverage for themselves or their family. That's another decided advantage to getting talented workers to where they need to go and want to go. Perhaps the greatest advantage is that it removes the expense of health care off of American business. It's not just General Motors that's suffering because of the cost of providing medical coverage for their workers. Every small business is worried about providing this essential fringe benefit. If we can remove the need of business to essentially pay for this and cover it by a national sales tax on consumers rather than producers. That will create millions of new jobs in the future. Another decided advantage. Perhaps one of the best advantages of national health care would be a better use of the funds. Let's take a look and see how that advantage might work. Let's assume that those different components cost about the same amount each one, about $100 billion. Under national health care system, let's see if we can reduce the amount that the lawyers are being paid and spend that $100 billion or so perhaps in some other area, perhaps in more medical research. And what about all those profits for insurance companies? Well, we won't need insurance companies, nor will we need those million-dollar bonuses for those executives. And maybe we won't need so many clerks either. And we can devote more money to research, to providing better medical care. Unfortunately, despite this better use of funds and all of the great advantages, don't expect national health care anytime soon. The problem is with the politicians in Congress. The Republicans are there to defend the profits of those insurance companies and pharmaceutical companies. But actually, the Democrats are worse. They seem to reject national health care for a variety of reasons. Perhaps the most important is they want to make every government program some kind of scheme to redistribute the wealth. And it really seems to bother them to give a wealthy person free health care. They'd rather tax the wealthy person and provide sort of a subsidy for the poor. Another bad thing about the Democrats is they seem to be joined at the hip to the trial lawyers' special interest group and want to protect those big malpractice fees. If we can get over these kinds of political limitations, then we can have a national health care system, single payer, with all of the advantages that we have talked about.